Hi everybody, Ziv Simon here. Thank you so much for attending the training on how to build a top implant practice. You may have watched the recording, but in any event, I do appreciate that. And ever since this training came out, I had a lot of questions from dentists from all over the world asking me about how to gain success with implants. So remember I talked to you about the path of building a top implant practice, how to be successful, and it really starts with building a good implant site that has good bone quality and quantity and good tissue. And I talked to you about some techniques and strategies on how to do that. Because if you don't have a good implant site, you cannot place an implant, which makes total sense. But I see a lot of doctors are learning a lot of sophisticated procedures on how to place implants and all-on-4 and other things, while their site building skills are not up to par yet. So start with knowing how to build a site, know then how to strategize and place the proper implants. And I also talked to you about the importance of having specialized skills. I call them the magic bullets that make the first two skills work much better. And I do believe that having specialized skills increases your personal value level. So the more specialized things you can offer, the higher the value of your practice, the more patients can come to you and do more specialized work, the more you can build, the more you can charge. And I think that's the obvious. Now, a lot of doctors are asking me, do I have to be a specialist to be successful with implants? Do I need to have the socket shielding technique? Do I need to use PRF or dentin grafting and CGI, computer-guided surgery, to be successful with implants? And this is actually not true. If you think about the path to success, 80% of what we do is actually relatively simple, and it does not involve specialized skills or anything that you need a special setup for. Good site development, good planning, good surgical technique, and following the right systems and protocols allow you to have an excellent outcome with dental implants and allow you to have a very successful practice not involving specialized skills. Now, you have to do this really well, those 80%, to reach a great success level. And in this video, I wanted to give you a little bit more of a detailed path of about what cases you need to start with and how to build your knowledge and confidence and your skills gradually so you don't get too overwhelmed. So don't think that socket shielding and more specialized procedures, those magic bullets that are important for reaching the ultimate success level, are critical right now. 80% of what we do is relatively simple. It's based on sound surgical principles, understanding how to build an implant site, how to place those implants, good treatment planning, and simply add one specialized skill at a time. Don't overwhelm yourself with too many things, because we always have to go back to the basics. We need to build an implant site. We need to know how to place these implants in the proper angle, in the right position, have good surgical technique, and you'll get success. Okay, I got you all covered on that. So if you feel a little bit overwhelmed, and I'm talking to you about how to build a top implant practice, and you're just starting out, you're not even thinking about reaching the top yet, and that's totally normal, it's good to start by identifying your challenges. What are the things that you have trouble with? What are the problems that you've experienced so far, starting with the extraction process, the bone grafting, and perhaps the first steps of placing implants? What were your challenges? What are the things that you had trouble with, you were unsure about, you didn't have much confidence with? One doctor asked me following this training, I have a hard time with angulation and orientation of the drill. So naturally, you're stuck in step number 2, maybe not having enough confidence to drill in a specific trajectory. Maybe you don't know what's the ideal implant position or the ideal angulation depending on the circumstances. Maybe you don't have a good vision of how the restoration is supposed to look like. Maybe you don't know what to aim for. So these are things that are very important to get to the bottom of, because if you don't have a very clear understanding, a clarity about the ideal implant positioning, whether you know how to execute it clinically or not, you need to know this in theory. Let's figure this one out so we can have you place your implants with confidence and then supplement with more specialized skills. Now, some doctors ask me, I don't want to hit a nerve adjacent teeth, I don't want to perforate through the buccal wall or the lingual wall, and this is why I don't want to start with lower molars. And my answer is, if you don't want to hit a nerve and you don't want to hit adjacent teeth and perforate through the buccal wall and have all these problems, you should start with the lower first molar. This is the first natural option to get started. Typically there's enough bone. Typically there's enough surgical and restorative space. You'll have to study a CT scan. You'll have to know how to read scans to know where the nerve is. You'll have to understand where the undercuts are. But for most cases, this is an excellent site to start with. So if you're thinking about the path from starting with very, very simple cases and moving on to the complex, definitely consider starting with the lower first molar. If you can't deal with thin ridges, which was one of the questions, you know what? Stay with molar implants first. Stay with the lower molar, first molar, move on to upper molars, educate yourself about sinus lifting, about the osteotome technique, how to minimize the risk of perforation, slowly move on to upper second molars. Stay in the molar location because these ridges are typically not so thin. Now, if you're concerned with working around the mental foramen, same story. If the nerves scare you, stay there for a while. Stay there for about 2-3 months, 6 months, until you feel comfortable in terms of building implant sites, until you feel comfortable having a good strategy of placing those molar implants, and only then move on to the lower premolars. And it's again something that builds upon your confidence. If you're concerned with hitting a big artery where blood starts to shoot out like a water fountain, okay, one of the questions I got, you need to speak CT, my friend. You need to understand where the big arteries and the big nerves are and the blood vessels, and understand that this is a very rare thing that can happen. It can, but it's extremely rare if you know the anatomy, if you know where the particular anatomy is for every case, and that's why you need to speak CT. You need to know how to read CT scans. Okay, so stay there for a while until you feel comfortable, because some doctors are concerned with the aesthetic zone. I would not start my first case doing a central or a lateral incisor in the aesthetic zone, because it takes a bit more skills, it takes a bit more planning, a bit more knowledge. So stay there for a while until you feel comfortable moving to the upper central. It can take 6 months, it can take a year. Stay here and you've covered probably 80 to 90% of all clinical cases in your practice. You don't have to be under the pressure to start placing multiple implants all on 4, doing full mouth rehabs. You do it only when you build up enough confidence and skills, and maybe start adding those specialized skills to enhance those 80-90% results, and then start treating lower second molars where the distance to the nerve is usually closer. So you have to be a bit more careful. You may need to start introducing guided surgery to prevent nerve injuries. And then you start contemplating all sorts of questions. How much space do you need for an implant overdenture? One of those questions asked that I was asked after the training. Well, now that you have more experience, now you need to up your game in terms of prosthetics. Get some more knowledge about denture setup, about vertical dimension of occlusion. What is the right distribution of implants? How many? What locations? What angulation? How does the all-on-4 system work? How do we restore a full arch with implants or full mouth with implants? And what's the difference with overdentures, lip support, all of the above? That's extremely important. But then you have to really reach a high level up. You have to up your specialized skills But remember to do this very gradually, step by step. Start from very simple, increase your knowledge, increase your skills, learn some specialized skills, incorporate them, get some wins, get some complications under your belt, learn how to manage them before you jump to the ultimate full mouth rehab on implants. You get overwhelmed and confused. I would not support that. And last but not least, as you get to a lot of confidence and a lot of knowledge, only then move on to what I think is the most complex in implant dentistry, and these are the lateral incisors. The upper and lowers are always challenging. There's never enough bone. There's always some issues with soft tissues and the adjacent teeth, very complex. And I find dentists are getting into treating or replacing upper laterals before they have enough skills, experience, and knowledge with more simpler cases. Set yourself up for success. Learn how to build an implant site, learn how to place your implants, learn the strategies, the systems on the simpler cases where the risks of complications are lower, where there's not as much aesthetic liability, and then work your way up. And it doesn't take 20 years. It can take probably a year and a half, 2 years, but I want you to be successful with implants. I want you to build your own top implant practice, and this is kind of a path that I found works for a lot of doctors in terms of building their knowledge and confidence. A doctor asked me during this broadcast, when replacing implants in the posterior mandible, when doing the surgery, implant surgery in the posterior mandible, do I infiltrate or do I give an inferior alveolar block? And this is really based on a dogma that I also was taught almost 20 years ago, that if you operate in the posterior mandible, you should only infiltrate, not to block, because when you drill from the implant, when you create your osteotomy and gradually get closer to the nerve, the patient will tell you it hurts, and then you know not to create nerve damage. Well, it's probably one of the worst things that you can do, and it's based on pure dogma, and I know the intentions were right and there's some vague rationale to do that, but if you are counting on your patient to tell you when it hurts, to know not to reach the nerve, you probably should not be doing the case, because you could be very, very close and your patient will not tell you anything, maybe thinking that's supposed to hurt. And some patients have a high threshold for pain. They may not tell you and you're inside the nerve. So don't wait for your patients to tell you, or they may tell you, doc, it hurts, but you're far away because the patient is not adequately anesthetized. So don't rely on a signal from a patient to tell you how deep to go. It's just not a good way to practice. Understand CT scans, learn how to analyze them, speak the language of CT, plan your osteotomy, know where the top part of the ridge is, understand where the nerve is, know the buffer zone. The buffer zone is 2 millimeters in my recommendation. If you're starting out, create a buffer zone of 3 millimeters. Don't ever get closer than 2 millimeters because the drill itself is longer than the osteotomy for most systems. The message here is that you need to eliminate all the dogma and the misconceptions that you've learned in the past and follow common sense. Don't wait for your patient to tell you when it hurts so you will stop and not get into the nerve. It's just not the way we place implants currently. So you can definitely block, give an inferior alveolar block plus infiltration, a lingual infiltration, a long buccal infiltration, and also for hemostasis, very important. The patient will be very comfortable. You've analyzed the CT scan ahead of time. You understand where you're drilling into. You know the location of the nerve. You created a buffer zone of, let's say, 2 to 3 millimeters. That's very safe. And then incorporate specialized skills, guided surgery. Don't leave this to chance. Place your implants accurately, precisely, and also very safely. So the purpose of this video was to answer some of your questions, give you a little bit more information, and share some of the questions and the answers that came from this broadcast, and also give you a very clear path of how I see doctors advancing and becoming top implant surgeons and building a great practice that keeps growing and gives you enjoyment and more repeated business and patients coming back and referring their friends and family. And it really starts with a very simple path of knowing how to build implant sites, knowing how to place implants, having good strategies, good techniques, and also having specialized skills that will complement your bone grafting and your implant placement. So I believe that in order to be successful with building a top implant practice, you need to have a good understanding and clarity and know the strategies and tactics that the successful surgeons have, the top dentists in the world have. Copy them, emulate them, get the support, get the mentorship that you need to make sure that you're on the right path, that you're not deviating, that you're not following some sort of previous dogma and misconceptions that you have that are limiting your potential, because confidence is something that you can build, and it has to be built gradually. It has to be built through guidance and putting in the work, because we are not born confident. This is something that we need to develop. I need to develop my own confidence. In the past, I suffered from a lack of confidence in the surgical field. I put in the work, I followed, mentored, I committed myself to mastering this, and I committed myself to teaching doctors all over the world how to do the same. And this is one of the reasons I created the Implant Accelerator in the Surgical Master Academy, which is a live hands-on course that includes coaching and mentoring for a full year. It's really based on those 3 steps of building a good implant site, having strategies for placing implants, and teaching you how to acquire specialized skills, those magic bullets that will make everything better on your path to be a successful implant surgeon. So this course will teach you how to create great implant sites. It'll teach you the tactics and strategies to place the perfect implants, and also teach you specialized skills that the top surgeons in our industry use. So I want you to do the same. So if you want to learn the best practices and strategies and know what's working today, not last year, build your knowledge, build your confidence, and build your own top successful implant practice under my personal coaching and mentoring, and all in one place. You don't have to travel the world and get bits and pieces from all sorts of places. It's all in one centralized location. If you want all of that, then the Implant Accelerator program is for you. And this is how we do it. This training is a 3-day training in Beverly Hills, California, in the Surgical Master Academy. And it's happening very soon. It's limited in attendance. We can only accept 24 dentists. And each day is dedicated to one step on the path to success, starting with the implant site blueprint. You're going to learn the 3 most common bone defects that you'll encounter and how to handle them, how to choose and handle membranes and bone grafts, how to enhance your results with PRF, and also how to improve tissue quality and hands-on. The second day is dedicated to implant surgery tactics, and I'm going to teach you the strategies for implant placement. How many implants, what location, what angulation, how to focus on safety, and the whole thought process around placing implants. We're also going to talk about the best incisions and flap designs, what to do, what not to do, and all about the aesthetic zone, and talking about immediate loading versus delayed loading, how to focus on safety, how to deal with aesthetic challenges. Day number 3 is all dedicated to specialized procedures. These are the magic bullets that make the first steps more successful, more effective. We're going to learn about creating tunnels and enhancing implants emergence. We're going to learn about how to create a pedicle flap and harvest connective tissue. We'll have some hands-on as well. And what's really important is that I'm going to train you on the high performance mindset, how to get to a high performance level as a surgeon and hit all the important points when you're performing a surgery, so you don't have to be all scattered and lacking in confidence when you actually get to do this procedure. So these 3 days are dedicated to the 3 steps that you need to have on your path to having a successful implant practice. So if you want to learn the best practices and strategies, and if you want to learn what's working today and build your knowledge, build your confidence under my personal coaching and mentoring all in one place, the Implant Accelerator program is for you. I look forward to meeting you there. This program is fully guaranteed. So basically, you take the training, you take the knowledge, the full 3 days, you learn the skills, you get mentored and coached by me and become part of the Surgical Master Academy. And if you're not blown away, I give you your money back, and I also cover the flight back. Okay, so this is a very strong guarantee because I believe that this program is going to accelerate your implant practice. For the doctors that are joining now, they'll also be getting the full Implant Gold Rush Master's course. Doctors that will join will also get the Speak CT program, the CGI box, the complete implant strategy training that you can listen to anywhere that you're at. They'll also be getting the Bulletproof Surgeon, the roadmap from beginner to master surgeon, laying out the path that you need to start from the very beginning all the way to becoming a top implant surgeon. You'll also be getting the 3-day recording of the Beverly Hills Implantology broadcast. And for doctors who join now, you'll be getting 2 pairs of the Surgical Master scrubs and t-shirt and the surgical cap. And I stand fully behind this program. Take this training, gain the knowledge, become part of the Surgical Master Academy. And if you're not just satisfied is not a good word, if you're not blown away and feel this is the best training you've ever had in your life, I fully guarantee this program, and I give you your money back plus the flight. I pay for your flight to come here. I look forward to meeting you at the Implant Accelerator program. I look forward to personally meeting you, personally coaching and mentoring you, spending time with you, figuring out what are the best ways for you individually to get to a top level, to build your own successful practice. I believe the Implant Accelerator program is meant to do all of that, is meant to help you to reach the top level. I'm here to help you. Click the button below to join immediately. Take advantage of this program and all the bonuses that are now included for a very limited time. I look forward to you joining the Implant Accelerator program. Click the button below and join me today.